What if the heart pill you take every morning is quietly turning off your body's low blood sugar alarms? What if the shaking, the racing heart, the sudden weakness you're supposed to feel never happen at all? For some seniors, those off days, the dizziness, the constant fatigue blamed on aging aren't age at all. They're diabetes trying to warn you, while medication keeps everything unnaturally calm. For most people, low blood sugar announces itself loudly. The body reacts fast. Something feels wrong, and that reaction is what keeps people safe. But for some seniors, that warning never comes. Millions of older adults trust heart medications for protection. They're prescribed to reduce strain, prevent serious events, and keep the heart steady. And often, they do exactly that. But in diabetics over 65, especially those who have lived with diabetes for years, some cardiologists pause, because certain heart drugs don't make danger easier to notice. Sometimes they make it harder. Here's what most seniors are never clearly told. After 65, your heart and your blood sugar don't always want the same thing. Your heart benefits from slower signals, less adrenaline, less strain, more calm. But your blood sugar depends on fast warnings. That racing pulse that forces you to sit down, the hand tremor that tells you something is wrong, the uneasy feeling that stops you before danger escalates. Those sensations aren't a flaw. They're protection. Now imagine one medication quietly trying to calm all of it at once. No pounding heart, no trembling hands, no sudden signal when blood sugar drops too low. That's when danger changes shape. Because without those warnings, some seniors don't realize what's happening until they're already unsteady, confused, or reaching for support they didn't expect to need. And age complicates this even more. Fatigue feels normal. Slower thinking feels expected. Dizziness gets blamed on standing up too fast, so the warning passes unnoticed, which raises a question every diabetic senior deserves to hear and almost never does. Which common heart medication, one many seniors take every single day, is most known for muting low blood sugar warning signs? And why do cardiologists say this isn't about stopping medication, but about asking the right question before the risk becomes silent? The heart medication cardiologists watch most closely in diabetic seniors is a group called beta blockers. These medications are commonly prescribed to protect the heart, to slow it down, reduce strain, and calm overactive signals. They're used for high blood pressure, irregular rhythms, and after heart events to reduce future risk. For many people, that protection is essential, sometimes life-saving. And that's why millions of seniors take beta blockers every day, often for years, without ever being told there's something specific to watch for when diabetes is also part of the picture. Here's what rarely gets explained clearly. Beta blockers work by blocking adrenaline, the stress hormone that makes your heart beat faster and raises blood pressure. By calming adrenaline, the heart works more efficiently and with less strain. That's the benefit. But adrenaline has another role most people are never told about. It's one of the body's main warning messengers when blood sugar drops too low. Normally, when blood sugar falls, the body reacts fast. The heart speeds up. Hands begin to shake. There's a sudden uneasy feeling that forces your attention. Those reactions aren't a flaw. They're protection. They're what prompt you to sit down, check your sugar, eat something, or act before levels drop too far. Beta blockers don't cause low blood sugar. That part matters. But they can quiet the body's ability to warn you that it's happening. So when blood sugar falls, the alarms don't sound the way they used to. The signals may feel weaker, arrive late, or never fully appear. Instead of obvious warnings, some seniors experience something much harder to recognize: heavy fatigue, slowed thinking, weak or unsteady legs. A vague sense that something feels off, and because those symptoms don't feel urgent, they're easy to dismiss. After 65, this becomes even easier to miss. Aging already softens nerve responses and hormone signals. The body sends messages more quietly than it once did. When beta blockers further reduce adrenaline on top of that, the warning system can become extremely subtle. That's where risk quietly increases. Because without clear alarms, people don't react as quickly. Blood sugar stays low longer. Balance becomes less reliable. Confusion lingers, not in dramatic ways but in everyday moments, standing up and feeling unsteady. Missing a meal without realizing why. A short walk that suddenly feels exhausting. A moment of confusion when you expected to feel fine. This doesn't mean beta blockers are bad, and it doesn't mean they shouldn't be used. It means awareness matters more as the body changes. Low blood sugar is supposed to scare you a little. That fear is the warning, the racing heart, the trembling hands, that anxious signal that says something is wrong. But when those alarms don't sound, danger doesn't disappear, it changes shape. For many diabetic seniors, low blood sugar no longer announces itself. It feels quiet, almost normal. And that's why the most serious episodes aren't always obvious. They show up as unsteady steps, missed signals, moments that don't make sense until you look back and realize your body was trying to warn you softly. That risk grows even more for seniors who live alone or who manage diabetes by routine instead of frequent checking. When no one else is around to notice small changes, quiet warning signs are easier to miss. A skipped meal, a slower response, a brief moment of confusion that passes quickly enough to ignore. After 65, constant tiredness becomes easy to excuse. It gets blamed on age, poor sleep. Just one of those days. But what if that exhaustion isn't age at all? What if your morning walk feels heavier than it used to? What if simple chores drain you faster, even though your heart tests haven't changed? Not because your heart is weaker, but because your body's warning system is being slowed down. Most seniors don't notice this shift all at once. It happens quietly, a little less movement, more rest during the day. Avoiding effort that once felt normal. And without realizing it, low blood sugar starts feeling like general fatigue instead of a clear warning. That's the aging trap. Once tiredness gets labeled as just getting older, warning signs stop being questioned, movement decreases, signals grow quieter, and the body adapts not to safety, but to a lower, riskier baseline. That's where independence can quietly shrink, not suddenly, not dramatically, but step by step. This is why doctors don't rely on blood sugar numbers alone in older adults. They listen for changes in energy, balance, daily function. Awareness, especially after certain heart medications are added, because numbers don't reveal how someone moves through their day, but function does. This is also where many seniors start feeling confused. Diet hasn't changed. Routine feels the same. Medications are taken correctly, yet blood sugar becomes harder to predict. Lows arrive without warning. Highs linger longer. Suddenly diabetes feels harder to manage, even when you're doing everything right. That frustration can be unsettling. It makes people question themselves, but this isn't failure, it isn't carelessness, and it isn't always disease progression. The real danger isn't dramatic spikes or crashes. It's the slow erosion of control, while the cause hides in plain sight, mislabeled as aging instead of a medication effect that deserves attention. That's why cardiologists approach heart treatment differently in older adults with diabetes. They know something many patients are never clearly told. What protects a 50-year-old heart doesn't always protect a 70-year-old diabetic body the same way. In older adults, the balance shifts. Side effects matter more. Signals matter more. Awareness matters more. The goal isn't aggressive heart slowing. It's balance, clear warnings, predictable blood sugar, and heart protection that works with an aging nervous system, not against it. And here's the empowering part most seniors never hear. One thoughtful question can completely change how care is managed. Not, should I stop this medication? But could this be affecting how I feel low blood sugar? That question doesn't create conflict. It creates clarity, and good cardiologists welcome it because they don't want silent risks. They want patterns, feedback, and the connections you're starting to see now. For many seniors, it also helps to ask a slightly different kind of question. Not one driven by fear, but by awareness. Questions like, is this medication known to affect blood sugar warning signs? Or, are there options that protect my heart without muting those signals? For diabetic seniors, asking isn't about distrust. It's about making sure heart treatment isn't quietly interfering with the signals that keep you safe, independent, and confident day to day. It's about understanding how different parts of your body work together, especially as they change with age. So here's a question worth pausing on. If your blood sugar dropped tonight, would your body warn you clearly, or would it stay silent? Many people assume danger always announces itself loudly, with pain, panic, obvious symptoms. But the most serious risks often arrive quietly. No panic, no pain, just subtle confusion, unexpected weakness, or an off feeling that gets brushed aside because it doesn't feel urgent enough. And that's why this conversation matters, even if you've taken the same medication for years, because the body you had at 55 is not the body you have at 70. Signals change, responses soften, and systems that once worked smoothly can behave differently as age, diabetes, and time reshape the body. When warning systems grow quieter, awareness becomes your strongest protection. That doesn't mean fear. And it doesn't mean changing anything on your own. It means understanding what your body is telling you now, not what it told you decades ago. If this video helped you connect dots you hadn't considered before, take a moment to think about your own experience. Have you noticed fatigue that never quite made sense? Moments of confusion you couldn't explain? Off days that didn't match what your blood sugar numbers showed? Or times when low blood sugar simply didn't feel the way it used to? If so, you're not imagining it, and you're not alone. Many seniors notice these changes quietly and assume it's just part of aging. Sharing your experience can help someone else recognize the same pattern sooner. If you're comfortable, leave a comment and share one change you've noticed over the years. Your experience might be exactly what someone else needs to hear. And if you want more clear, calm explanations that help you understand how aging, medications, and diabetes interact, without fear, hype, or pressure, consider subscribing. These conversations matter because staying informed isn't about perfection. It's about protecting your independence, your confidence, and your quality of life one thoughtful question at a time.